Hi there, my name is Sydney. I am a second year medical student at UBC's Vancouver Fraser campus. And I was super grateful this year to attend the Institute for Healthcare Improvement, or IHI's 2020 forum, which typically would have been out of Orlando, Florida, but this was the first year that we attended as an online platform. And so just reflecting on some of my experiences, the conference just ended yesterday. And I remember the first time that I logged into the IHI's virtual lobby this year, which was a little bit different than your typical conference experience, but it was super cool to see just an overwhelming number of opportunities to learn, engage, and connect with a really exciting group of speakers this year and audience members. So one of the coolest places to start on the virtual lobby was the Innovation Theater. This was a chance for me to learn about opportunities for patient safety, how different institutions in the US have been using big data to enhance surgical quality. And these were some of the sponsored talks by some pretty high-level groups of groups and companies and institutions that are using quality improvement on a day-to-day basis. On the first day, I attended one of the most riveting workshops that I think I've ever been to on how to create effective patient flow in the emergency departments. And this was a group that was critically investigating how we can expand quality improvement projects actually to go beyond the hospital and out into the community, because finding beds for people to stay in and having sustainable food sources was really a way that they saw to sustain improved health outcomes beyond the four walls of a hospital. The next place on the IHI's virtual lobby that I checked out was the storyboard section. And I was really fortunate this year to actually have my own storyboard chosen to be represented at the IHI forum. So my storyboard was on respecting patients' goals of care by ensuring continuity of care across the spectrum of their illness trajectory. So it was really amazing to see my own name and my project and my passion beside some of these amazing quality improvement superstars from multiple countries and with really impressive backgrounds. So I had been fortunate enough to participate in an internship over the summer with the BC Patient Safety and Quality Council. And my project was really focused on how do we establish best practices in palliative medicine in terms of sharing conversations and sharing values between acute care, community care, and long-term care settings, so that every single player in a patient's medical team is on the same page about their end-of-life care goals and their values, as their illness trajectory progresses. So I felt really fortunate to present on something that is really important to me, both in terms of patient safety and in our ability to provide patient-centered care. But one of the most impactful components actually came on the last day of the conference, where I had the chance to listen to Dr. Donald Berwick speak, who was the past president of the IHI. He gave a really amazing talk about polarization. So this idea that our countries and our medical systems, we exist in this very siloed and polarized state. And he used a really good example of the 2016 election to kind of address this concern of polarization and how this can actually contribute to negative health outcomes. So the main takeaway from this was that contact between people will always reduce prejudice. So more contact, less prejudice. And he talked about it in this dose-dependent manner that really stuck with me. He brought in these two remarkable women to tell a story of their own quality improvement project, and it was called Hands Over the Hills. And so Hands Over the Hills was a grassroots initiative to bring individuals from polarized places in the United States, so one being in a very traditional blue state, one being in a very traditional red state, who thought that they had nothing in common. And this was right after the 2016 election, so the landscape was very politically charged. So this quality improvement project was where this woman and her family went from rural Kentucky to live in the homes of people in Collegetown, Massachusetts. And some of the insights that they shared were quite astonishing when these women had the opportunity to listen to each other, gain an awareness and respect of people who have lived, very different lives. And just reflect that the person sitting in front of you is so much more than the vote. Because the idea of this project was really to get a better understanding of why somebody was voting for a person or a party that the other group just really didn't understand. And so, I sat there listening to this wonderful project and speech and reflected on this following our very recent 2020 election, or the United States 2020 election. And it was quite refreshing and uplifting to see instances of respect and bridging over this huge political chiasm. And I know obviously that we're not immune to this in Canada, whether it be politically, socially. There are divides that separate us as people. And even just looking at our own health authorities in BC, we have a really hard time communicating and understanding the needs of different populations. And I just took away from this huge importance of collective development and the power of proximity. One of the most powerful quotes that Dr. Berwick used was that humans cannot demonize people they know. If you put enemies together and break bread, they cannot hate each other. And, I want to take with this into my own, medical practice in the future, into my own relationships. And Dr. Berwick encouraged everyone to take a risk, to spend time together with people that you don't know, not with the intent to change them or to change yourself, but just to establish common ground and get to know one another. It was clear that Dr. Berwick was a master of narrative medicine and used these instances to lift and elevate patient stories and showcase opportunities for change. And I really think that these are ideas that, extend beyond the walls of a hospital or a health authority. And they're change ideas that I'm excited to bring, not only to my QI project, but also to my career and relationships. In this era of COVID, where burnout among healthcare providers is so pervasive, this inspiring story really left me with renewed motivation to engage and create a dialogue of connection. Another amazing takeaway that I had from the IHI conference was a session entitled "When Crises Collide: How do we sustain opioid and substance use disorder priorities in the face of a pandemic?" And I thought it was really interesting to learn more about how the COVID pandemic has disproportionately affected those with substance use disorders. And even as our attention has shifted to talk more about COVID in the news, the opioid crisis has continued in silence and has actually worsened. And to reflect on this from BC, where our numbers of opioid-related deaths have reached record highs during COVID, it simply reaffirmed the importance of addressing policy and organizational changes to both implement and measure our methods of improvement. And I really think that my opportunity to listen to this workshop and engage will be quite beneficial as I am working with the Political Advocacy Committee at the UBC Medical School to create an evidence-based policy paper advocating for harm reduction and decriminalization regarding the opioid use crisis. So I'm excited to take some of those tangibles that I gained from that workshop into my policy paper. So this session really impressed on me the reciprocal relationship between both of our ongoing pandemics. And it shows just how social justice initiatives can actually target both at the same time. And I realized just how stark the influence of isolation, service disruption, and depression and anxiety has had on opioid-related morbidity and mortality. So throughout the conference this weekend, I was really moved by the sense of community and how continually motivated the creators and quality improvement superstars have been. The solutions that they offered were oftentimes simple and ones that I think could be implemented into our own healthcare systems here in Vancouver. I was left inspired to continue to bring this growth mindset to my future clinical career that I will soon be entering. I would first like to thank the BC Patient Safety and Quality Council, as well as the IHI UBC chapter for this amazing opportunity to attend the IHI Forum this year. As well, I would like to thank the Institute for Healthcare Improvement for hosting such a lovely conference with an amazing roster of speakers and really finding ways to engage community even from an online platform this year. And finally, I'd like to thank my colleagues at Vancouver Coastal Health and the RPACE team who supported my quality improvement internship and really fostered my love for QI. And thank you for listening to this short vlog.